And I'm actually going to start us off today. Like Mike said, my name is Jana Howe. I'm the program manager for Ohio Family and Children First. And my co-presenter today is Jenny Horner. She's one of the regional coordinators for our office. So we really appreciate having the time to speak with all of you today. Next slide, Jenny. If you look at our agenda, we're going to provide some information about our office, Ohio Family and Children First, but then we're going to spend the majority of our time talking about the amazing work of the local Family and Children First councils throughout the state, because they're definitely the real stars of this show for sure. We're going to talk a little bit about the core functions and responsibilities of FCFCs on both the macro and micro level, the shared plan work that is done by the FCFCs and service coordination and wraparound services that they provide to families and youth in their communities. And if we have time, we're then going to end our presentation with just some data of the youth served by FCFCs in state fiscal year 25. Next slide, Jenny. Ohio Family and Children First and the local Family and Children First agencies have actually been around for over 30 years. In 1993, our agencies were created in law with a specific purpose to help families seeking government services by streamlining and coordinating existing services for families seeking assistance for their children. To effectively do this, FCFCs must address the micro needs, which means working directly with the youth, families, and teams in their communities, and address the macro needs, convening system partners and stakeholders in their communities, including families, to identify gaps and strengths in the system of care and develop activities to address gaps and build on those strengths. That was a big mouthful, but hopefully over the next 15 or 20 minutes or so, we can help break it down to make it make more sense to all of you. Next slide, Jenny. So we have a small but mighty team at the state office of Ohio Family and Children First. Our team is made up of our executive director, Colleen Tucker, myself, the three regional coordinators, Jenny Horner, Amy Matusik, and Alex Johnson. And then finally, we have Katie Howard, who does all things related to OASIS, which is our data and case management system. Our office's primary purpose is to support and provide oversight and technical assistance to the local Family and Children First councils throughout the state. We do this through a wide variety of methods. Like everyone else, we hold meetings, we respond to emails, phone calls, text messages. We offer trainings to the local Family and Children First staff, and we do face-to-face contact with our county partners. Our regional coordinators are actually field staff, so they visit each FCFC at least once annually, and they attend a council meeting in each county at least on an annual basis. If you ever want to get in contact with us with any questions, we do have a general email box that's there on this slide. That's ofcf@childrenandyouth.ohio.gov. Next slide. I mentioned on the first slide that the FCFCs need to address both the individual and system needs in their communities. How do they do this? They follow the four core functions and responsibilities triangle. This triangle represents the four core functions: engaging and empowering families, building community capacity, coordinating systems and services, and shared accountability that FCFCs are required to address. Next slide. As I stated, the work of the FCFCs is broken into two categories. The macro work is the work that the council does as a whole, which I'm going to talk a little bit more about over the next couple of slides. And then the micro work is done with individual youth and families through service coordination or wraparound. And Jenny's going to talk more about this. In both the macro and micro work, the four core functions of the FCFC are present. I'm not going to read this entire slide to you, but if we just kind of take a look at the first two rows to see how an example of how the core functions impact both that macro and the micro work of council. So if you look at the first row, engaging, empowering families, which is one of the core functions of an FCFC. At an individual level, service coordinators engage families by listening to their needs, building rapport, and having open communication with the youth and family to help meet to meet that individual youth and families' needs. At a system level, councils involve families in program and policy development, which includes ensuring that family reps are active members of their council. Another example is if you look at the second core function of building community capacity, at a micro level, FCFCs work with youth, families, and teams to link them up with services and supports. They work with the youth team to look at creative ways to address that youth and families' needs. At the macro level, councils build community capacity through a 3-year shared plan that they use to address gaps and needs within their communities. And we're going to talk a little bit more about that shared plan and what it all includes in a couple of slides. Next slide, Jenny. So who's on Family and Children First Council? On this slide is the mandated members per the Ohio Revised Code. So in every county, this would be the minimum members of their FC council. It includes the main child and youth serving organizations in each county. Many FCFCs have expanded their member list to include other organizations working with youth and families in their communities, but this would be the minimum membership of each council throughout the state. And just as a note, FCFC meetings are public meetings and open to everyone. Next slide, Jenny. So we talked about one of the core functions of the FCFC was building that community capacity. FCFCs are required to develop and implement a process that evaluates and prioritizes services in their county, fill service gaps whenever possible, and invent new approaches to achieve better results for families and children. FCFCs do this through the shared planning process. The shared plans run on a 3-year cycle. The current shared plans are effective state fiscal year 26, which we're currently in, to state fiscal year 27. So for those of you that don't know state fiscal years quite like we do, that would be July 1st, 2025 to June 30th, 2028. So each FCFC right now is working on that 3-year shared plan. And then they focus on one or more shared priorities in their communities for this 3-year period. And once they have established that those priorities, they develop outcomes around these priorities. So for example, if an FCFC has a shared priority of increasing school readiness in their county, their outcome could be by the end of state fiscal year that 20% more youth across the county demonstrate kindergarten readiness via the kindergarten readiness assessment. Another example would be if their priority is reducing the number of youth in congregate care, the outcome could be that by the end of state fiscal year 28, 20% less youth across the county are placed in congregate care settings. So once they have those priorities and outcomes developed, then the councils focus on what activities are they going to do over that 3-year period to move the needle on those outcomes and make a difference in the lives of the youth and families in their county in those areas. Next slide, Jenny. So we did some data regarding the shared plans across the state for state fiscal year 26-28. And all of the priorities fell in one of 13 categories. As you can see, there are a lot of FCFCs working on the same priority areas. We have 67 FCFCs throughout the state that have a shared priority regarding services and supports for multi-system youth. 27 have a priority regarding school readiness, and then we have 21 that are working on reducing youth in congregate care, and 21 that are focusing on mental health supports. But once they develop these shared plans to use over that 3-year period, they're constantly evaluating the work of their shared plan. They regularly bring this up at their council meetings and discuss what is going right, what is not working. They gather data throughout the life of this 3-year shared plan to evaluate, are the activities that we are doing helping to move us in the right direction? And if not, then they consider why not, and where do they need to make adjustments? And so it is, again, bringing that whole team of those child and youth serving professionals from those organizations in their county together to help. It's not just the FCFC staff doing this work, it is the broader council and their organizations that are on their council assisting because it is the community's plan, not just the FCFC's plan. So that is just kind of a brief overview of the work on that macro council level. But now I'm going to turn it over to Jenny, and she's going to talk more about the micro work of the FCFCs.
Thanks, Jana. When we think of why service coordination, well, it's evidence-based. It ensures a more structured process so families know what they're committing to. And it reduces gaps and duplications of services in the county, which then improves outcomes. And finally, it acts as a bridge between the family, the providers, and the county systems. Service coordination is available to children and youth 0 to 21 with multi-system needs. We're unique in that the referral process is based on the youth's needs, not income eligibility. Our Family Services and Supports funding is demonstrating how these funds and the FCFC service coordination process are leading to a cost-effective method in obtaining better outcomes for the children and families they serve. These funds within the coordination of systems and services of FCFCs increase family stability, empower families, support safe and healthy children and youth, and offer cost-effective interventions and supports for children to remain within their homes and their communities, which is our priority. So there are phases of service coordination that you will see in every county. The first is assessment. It's important to not only identify the needs of the family and the youth, but to also assess the family's strengths as well as any preferences of all members of the team. Most counties utilize the CANS assessment to gather this information. However, it is not used so much as an eligibility tool, but more of a conversation with the family to assess needs and strengths and gather history of the family. The next phase is planning. During this phase, the team develops a person-centered service plan together that is individualized, specific to the needs and strengths of the family. Then the next phase is linking and advocacy. During this phase, the team connects families to any appropriate services necessary and ensures the rights and choices of all are respected on the team. Next is monitoring. The service coordinator continues to track progress of the individualized plans of care and adjusts as necessary. It's also meant to reassess the strengths and needs every 90 days. And finally, transition. During this phase, the team begins to step back and allow families to naturally lean on supports over time on their own. There are core components of service coordination, and the first, obviously, is to create the team. A multi-system team is formed when youth needs involve more than one system. Youth and families are expected and encouraged to fully participate in the service coordination meetings as well. The next is confidentiality. Issues of confidentiality, least restrictive environment, and cultural sensitivity are all addressed in all phases of service coordination process with the team. Teams are created from the family's network of personal and community connections or needs. Assessments. As I discussed, a standardized process or tool is used to assess both the needs and the strengths of the youth and the family to create that individualized plan. Counties utilize either the CANS, the CASI, or other standardized assessments to gather information of strengths, needs, and history. A crisis and safety planning component is also very important. Crisis plans are created detailing options for preventing known short-term crisis situations based on the family need to prevent emergency room visits or law enforcement involvement. Safety plans are developed as needed if the youth demonstrates any safety concerns at all. The plans are detailed and easy to follow with step-by-step instructions for the family. Next is monitoring. The service coordinator is assigned to track the progress of the family's plan, to schedule reviews, and to facilitate the service coordination plan meetings. The team members work cooperatively and share responsibility in developing, implementing, monitoring, and evaluating resources and progress. Then comes the individualized plans of care. Strengths and needs are utilized to create plans of care that are individualized and developed for and with each team and family. The team together develops and implements a customized set of strategies, supports, and services that the youth and family needs. The families and youth's perspectives are intentionally elicited and prioritized during all phases. Planning is grounded for family members' perspectives, and the team strives to provide options and choices that reflects family values and preferences. There is a dispute resolution component of service coordination. This process is available to dispute anything in the plan that's not agreed upon and can be accessed by both the parents and team members. The next component is advocacy. A youth or family may invite or request a family advocate, mentor, or peer support person to participate in service coordination team meetings. And finally, transition. Families exit the service coordination process with a clear plan of action steps and supports in place for them. So why does this process matter? Well, first, continuity of care. The process of service coordination prevents service gaps in the community for families. Families are more connected and more engaged with services and community offers. Next is efficiency. Service coordination reduces the duplication of services in the community, as well as reduces wasted resources that often go underutilized. And finally, empowerment. Service coordination promotes family independence and provides informed decision-making. The team implements service and support strategies that take place in the most inclusive, most responsive, most accessible, and least restrictive settings possible. And that safely promotes child and family integration into home and community life. The strength-based approach identifies, builds on, and enhances the capabilities, the knowledge, the skills, and the assets of the child and the family in their community and other team members. The process ties both goals and strategies to observable or measurable indicators of success and supports for better outcomes. With collaboration, connection, communication, and consistency, positive outcomes are achieved through service coordination. Teams report improved health, improved social outcomes, improved family relationships, decreased negative behaviors both at school and home. Families feel more engaged in services, and prevention of out-of-home placements. The following slides depict our data collected for youth served with services and supports funding through Ohio Family and Children First. The total number of children served with OFCF family-centered services and supports funding between the ages of 0 and 22 throughout state fiscal year 24 was 2,444. Youth ages 11 through 17, you'll see, represent the largest group served through FCFC service coordination with FCSS funds, and consisted of 60% of the total population being served. The majority of the youth were male, consisting of 62% of the population served, and females made up of 37% of the population served. Statewide, 14 different systems were accessed to meet the needs identified for individual families. The top 3 most involved systems were school, mental health, and job and family services. Since all youth funded must have at least 2 systems involved, the data demonstrates how systems overlap to meet the individual needs of the youth served. The reported data connected to the use of FCSS funding and the FCFC service coordination process are leading to a cost-effective method of obtaining better outcomes for the children and families being served. These funds within the coordination of systems and services increase family stability, empower families, support safe and healthy children and youth, and offer cost-effective interventions and supports for children to remain within their homes and communities. So if you would like to refer a family to FCFC, you can easily find the county's contact information on our website. Our website is www.fcf.ohio.gov. And if you're a subject matter expert and your agency would like to participate in your county FCFC, if they haven't already, we invite you to contact your local FCFC administrator regarding membership. I know they'd love to have you. Jana and I have both placed our contact emails as well. If you have additional questions outside of today, feel free to reach out to us. Other than that, are there any questions?